Dealing with difficult team dynamics. Sometimes running a skill station may feel like trying to herd cats. What do you do if everyone in the group starts asking questions? How do you handle receiving an inaccurate differential diagnosis? Let's explore how to handle difficult team dynamics. Dealing with multiple questions for one instructor. Skill stations are an exciting interactivity. At times, students may begin to ask you questions all at the same time. What do you do when everyone starts talking at once?
What is the patient's blood pressure?
The blood pressure is...
Who found the patient?
What is the pulse ox reading?
Who found the patient?
What is the pulse ox reading?
What is the patient's blood pressure?
Blood pressure is 132/76.
Who found the patient?
That was the patient's husband found her unresponsive on the floor.
What is the pulse ox reading?
Pulse ox is 98% on room air.
An unprepared instructor can disrupt the team's dynamic by slowing down the pace of a skill station. Students will become disengaged and frustrated if they have to wait around while an unprepared instructor looks for basic answers on a patient's condition. A collection of bored and frustrated students will not make an effective team. Let's see how a prepared instructor handles the situation.
What is the patient's blood pressure?
Blood pressure is 132/76.
Who found the patient?
The patient's husband found her unresponsive on the floor.
What is the pulse ox reading?
The pulse ox is 98 on room air.
The key to success is preparation. Before the course, memorize the dispatch information, the patient's presentation, the patient's signs and symptoms, the patient's vital signs, and the patient's final diagnosis. You should be able to answer any question on the patient's condition without having to consult your notes. Inaccurate diagnosis. Sometimes the team leader may offer an inaccurate diagnosis that starts to lead the group down the wrong path. Let's see how you can handle an inaccurate diagnosis.
I think we can rule out any respiratory issues. Let's move on to the physical exam.
Well, before you continue, should you consider the patient's pulse ox reading?
Well, her airway is patent. I think it's time to move on to the physical exam.
Well, I'm concerned the pulse ox reading may reveal a life-threatening event. If that's the case, what would you do?
As the instructor, there may be times that you need to get the team leader back on the path to the correct diagnosis. In the field, the patient often displays visual clues that remind the student what needs to be done next. For example, a patient with poor oxygenation may have shortness of breath or pale skin, indicating that the EMS provider must focus on the patient's breathing. In the classroom, the patient's signs and symptoms are not always on display. The visual clue that tells the student which path to take is missing, and the student may not remember all of the details on the patient's condition. As the instructor, you should remind the student of the patient's signs, symptoms, and vital signs in order to get the student back on the right path. Recapping the patient's information is not revealing the answer. It is providing the student cues a real patient would be demonstrating and then waiting to see if the student connects the cues to the correct answer. Dealing with difficult team dynamics. Key points. Be prepared. Memorize or list the clues on a quick reference guide to help you quickly provide the patient's information so you can answer questions without consulting your notes. Also, provide verbal clues to replace the missing visual clues.